All right, here we go. Hello, everyone. My name is Dr. Marty Kotler. Thank you for attending this webinar on the new 2023 Concussion and Traumatic Brain Injury ICD-10 codes. Just a little disclaimer before we get going. The information in this webinar is for educational purposes, and it's not intended to substitute your thorough clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target coding doesn't provide legal services. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this webinar is 100% accurate. However, it's not guaranteed. We have a lot of people listening to this webinar. Some of you are past attendees of our webinars and seminars. Some of you are members of Target Coding, and some of you have no idea who I am. I know we have brand new doctors of chiropractic listening to this webinar and brand new office staff and admin employees. So if you have no idea who I am, let me tell you a little bit about myself. Again, my name is Dr. Marty Kotler. I am a chiropractor. I practiced for many years, 16 years prior to starting my company, Target Coding. I'm also a certified professional compliance officer, certified billing and coding specialist. That's what all those initials are after my name. And my company's been helping thousands of chiropractors and their staff members for over 14 years. My area of expertise is in compliance as it relates to billing, coding, documentation, Medicare, HIPAA. I've written numerous training manuals for chiropractors, physical therapists, acupuncturists, massage therapists, and nurse practitioners on billing, coding, documentation, Medicare, and HIPAA. Work with hundreds of healthcare providers nationwide. I write articles to the major publications you see coming across your desk, like Dynamic Chiropractic, The American Chiropractor, Chiropractic Economics. I'm a guest speaker at multiple nationwide seminars and conferences. And I consider myself kind of unique because most chiropractors are not certified coders. Most certified coders are not chiropractors. So you'll see how I combine both specialties to make sure you're doing things right and you're getting reimbursed what you deserve. All right, let's begin with the basics of concussion and traumatic brain injuries. There are three types of TBI. TBI stands for traumatic brain injury, severe, moderate, and mild. So a concussion is a type of TBI. It's just not as severe. You can consider it a mild type of traumatic brain injury, but even though it's mild, it should be taken very seriously. Although not typically life-threatening, it could be life-altering. Concussions, what causes them? It could be very simple. A simple bump to the head. You're sleeping and you fall out of bed and you hit your head against the night table. A simple blow or jolt to the head. Concussions could be a result of when the skull and brain move quickly back and forth, like in Whiplash. I'm going to touch on Whiplash in a few minutes. The sudden movement of the brain inside the skull causes abnormal stretching of the brain cells that can cause chemical changes. And then what? That can alter the way the patient feels, acts, sleeps, thinks, learns. Neurocognitive changes can occur, causing a lot of different problems. Memory issues, concentration problems, problem solving. Some patients feel symptoms for just a short period of time and feel better within a couple of weeks. Others may have long-term or lifelong effects from the injury. TBIs can cause a loss of consciousness, amnesia, nausea. Patients with multiple or repeated concussions may experience a longer recovery. Long-term problems can include headaches, tinnitus, dizziness, fatigue, balance issues, slurred speech, convulsions, and seizures. I'm going to be giving you ICD-10 codes for a few of these. So now something recently happened in the NFL, and this injury that occurred, I'm sure many of you have heard about this horrible injury to a player for the Miami Dolphins quarterback, Tua Tagovailoa. I'm not sure I'm pronouncing his last name properly. We're just going to call him Tua. And this injury that occurred, see, I have a big passion for sports. I'm a huge sports fan. I love the NFL, I love baseball, love football, baseball, basketball, hockey, and I'm also interested in medical issues, being a doctor. So this combination of sports and and injuries, medical injuries, has resonated with me. So Tua had concussion number one on Sunday, September 25th versus the Buffalo Bills. He was moving backwards, he got pushed, and then he fell to the ground and hit the back of his head against the ground. What does he do immediately? He grabs his head in pain. Look at that photo. He's grabbing his head in pain, and then he got up and he stumbled. And then he's like shaking his head to get the cobwebs out of his brain. And now he's moving his head side to side. And then he stumbles and he had to be held up by his teammates and medical staff. I witnessed this. I immediately thought, concussion, this guy should be taken out of the game. Halftime comes around. I go get a snack, a drink. I come back. I see him back in the game. I was shocked. He claimed it was a lower back injury. Now, I understand this was a big game. The Dolphins are, doing well. This was a big game. So the desire to get back in the game, I understand. He claimed it was a lower back injury. The Miami Dolphins team medical doctor, and then the NFLPA has an unaffiliated neurotrauma consultant medical doctor specializing in trauma, probably very intelligent doctor, and I'm sure the Miami Dolphins team trauma MD is a genius. They're both probably very intelligent doctors. Well, they allowed him to re-enter the game. Shocking. So, in my opinion, they did not follow the NFL concussion protocol. They have a term, it's called gross motor instability. It was obvious this patient slash quarterback for the Dolphins had gross motor instability. It was very easy to see on TV. It was not a lower back problem. He didn't even reach for his lower back. So I know there's a lot of opinions. I know some of you be saying, well, how can you diagnose him without actually seeing him? How can you diagnose him with a concussion? A lot of people were saying, well, I'm not a doctor and I think he had a concussion. Well, I am a doctor and I 100% am guaranteeing that he had a concussion on that Sunday, September 25th versus the Buffalo Bills. And a couple of days after this, Chris Nowinski, PhD, the co-founder of the Concussion Legacy Foundation, he sent out a tweet prior to the next game. So Tua was cleared after this game. Shockingly, he was cleared after the game against the Buffalo Bills. And now the next game is 4 days later against the Cincinnati Bengals on a Thursday night. But prior to the game, Chris Nowinski sent out this tweet. It went viral. It said, if Tua takes the field tonight, it's a massive step back for concussion care in the NFL. If he has a second concussion that destroys his season or career, everyone involved will be sued and should lose their jobs, coaches included. We all saw it, even though they must know it isn't right. Again, those 5 classic concussion signs. He grabbed his head, he got up and stumbled, he shook off the cobwebs, he moved his head side to side, he then fell and had to be held up by his teammates. There's photos of it right there. Then 4 days later, concussion number 2, Thursday, September 29th versus the Cincinnati Bengals. 4 days later, Tua is tackled and hits the back of his head again against the ground. He grabs his head in pain and has hands assume that fencing response position, indicative of a serious neurological disorder. I was watching the game with friends. They were not doctors. I said immediately, look at his hands. It's almost that position when a baby, you suddenly scare a baby and they outreach their arms and his fingers were mangled. This was a severe traumatic brain injury. It was probably superimposed on the first one, 2 within 4 days could be deadly. So those hands, many of you saw his fingers. That's a severe neurological brain injury that occurred, which causes the fencing response posture. He's taken off the field on a stretcher with injuries to his head and neck. And at the present time, he is not playing. He's been ruled out for the next game. In my opinion, he needs to take a lot of time off. I would be shocked and appalled if he's back playing again within a week or two. So now let's go through some concussion ICD-10s. So concussion codes, the ones you see in blue are new for 2023. So basic concussion, we'll call it, without loss of consciousness, is S060X0, and then that dash there, that's for the encounter. A for initial, D for subsequent, S for sequela. If you've been to my seminars and webinars in the past, you know what those mean. So make sure you put those in properly. S060X1 is a concussion with loss of consciousness for 30 minutes or less. So there you go. That's the diagnosis for Tua. Concussion with loss of consciousness. He lost consciousness for a couple of minutes. He was out of it. And then there's a new code for concussion, S060XA, concussion with loss of consciousness, status unknown. And then we have S060X9, concussion with loss of consciousness of unspecified duration. S140XX, concussion and edema of the cervical spinal cord. Do you think Tua had edema of the cervical spinal cord? I think yes. I think his brainstem was shocked when he got hit that second time, and that's why his hands went into that uncomfortable, scary spasm. And then we have F07.81. That's post-concussion syndrome. Now we have traumatic brain injury diagnosis codes. Again, the ones in blue are new. So we have S062X0, TBI without loss of consciousness, X1 with loss of consciousness, 30 minutes or less. And then in 2023, additional information was added. Again, there it is in blue. Diffuse TBI with brief loss of consciousness. And then we have the loss of consciousness based on time. 31 to 59 minutes is 2X2. 2X3 is 1 hour to 5 hours and 59 minutes. Oh boy, imagine that. 2X4, TBI, loss of consciousness from 6 hours to 24 hours. And then we have a new code for TBI, diffuse traumatic brain injury with loss of consciousness, status unknown, S062XA, and 2X9, TBI with loss of consciousness, unspecified duration. There's more here. This is focal TBI, not diffuse, focal TBI without loss of consciousness, with loss of consciousness. There's the new one, S0630A, unspecified focal TBI with loss of consciousness, status unknown. What other ways can get a concussion? This is very common in chiropractic. Whiplash. Yes, patients are in automobile accidents. They're suddenly hit in the rear. Look at this little schematic here. Positioned neutral. All of a sudden, patient is hit in the rear. They're sitting at a stoplight. All of a sudden, they get hit in the rear. First thing that gets happened is that hyperextension and then hyperflexion. And that sudden movement of the brain inside of the skull, moving quickly back and forth, front to back, that's what can cause brain swelling and concussions. Of course, that type of injury, as doctors of chiropractic, we all know, that can sprain cervical ligaments. There's a nice photo of the ligaments in the neck. You should have in your exam. Evidence of sprained lumbar ligaments was noted in the exam to the interosseous ligament. Name the ligaments, that's S13.4. Muscles are going to get strained, S16.1. Headaches, absolutely. You can get traumatic headaches, acute post-traumatic headaches. See that word intractable? What does that mean? Intractable. When a patient comes in and says, I have headaches from whatever the cause, I recommend you ask the patient, what do you do for your headaches, Mrs. Jones? Sometimes the patient will say, I've tried everything, Dr. Kotler. I've tried over-the-counter medication, prescription drugs, biofeedback. I even tried Botox injections right into my head. Nothing helps. That's considered intractable. Not intractable, the patient is responding to conventional methods. Now, what's the threshold? How do you pick acute versus chronic? Well, use 12 weeks as your threshold. Sleep disorders can occur along with concussion and traumatic brain injury. Here are some sleep disorder diagnosis codes. They begin with the letter G. That's a different section. That's the nerve system section of the ICD book. Sleep apnea, insomnia, idiopathic, hyperinsomnia, sleep-related leg cramps, grinding of the teeth while sleeping, sleep disorder, G47.9. We have tinnitus, right side, left side, bilateral, yes. 11 is right side, 12 is left side, 13 is bilateral. Concussions can cause depression, anxiety, F41.8. Absolutely, concussions can cause dizziness, R42. That's it, just 3 digits, R42. All right, get your questions in because we are rounding third, heading home. We're just about done. So here, this is a brand new code, a neurocognitive disorder due to some physiological condition, F06.7. That's a brand new code for 2023. Here's another brand new code for 2023, vascular dimension, F01.511. We have many clients that work with cognitive disorders. A lot of doctors have taken the Carrick Institute trainings to help treat these types of brain disorders. Now, some of you may be saying, where do you get all this information, Dr. Kotler? When I do my live seminars on the breaks, a lot of CAs and some doctors will come up and say, hey, how do I become certified? How do you learn all this stuff? Well, the information I'm giving you today comes right from the official ICD-10 guidelines, which the new guidelines became effective just a few days ago on October 1st. This is right out of the guidelines. A joint effort between the healthcare provider and the coder is essential to achieve complete and accurate documentation. The importance of complete documentation cannot be overemphasized. The entire record should be reviewed to determine the specific reason for the encounter. Try to stay away from ICD-10 codes that say other or unspecified or uncertain. Here's a few more new codes for 2023. I think this is an excellent way to get more specific on disc issues. So if you have a patient, let's say, all right, Mr. Jones comes in, he's got a herniated disc at L4, L5 with radiculopathy. That means nerve root compression shows on the MRI. So that's M5116. But you're reading the MRI and it says, this patient has some annulus fibrosis defects, a large annulus fibrosis defect. Then you would add on M51.A2. Again, all the new codes for 2023 are in blue. And now we have similar annulus fibrosis defects in the lumbosacral region. So here comes Mrs. Miller. She has a herniated or bulge disc, sequestered disc, prolapse disc, whatever you want to call it. There's a disc disorder with nerve root compression at L5S1, and there's a small defect in the annulus fibrosis. Then add on the M51.A4. Okay, we're veering off a little bit from concussion, but here's some more new codes. Chronic fatigue syndrome related to the brain, G93.32. That could be maybe a sequela. Originally, there's trauma. So maybe Tua in 5 years from now. See, right now, Tua is like, I want to play. My teammates need me. I want to get out there. And I don't blame him. But in 20 years from now or 30 years from now, when he's home and he can't think properly, when he has dizziness and headaches, are his teammates going to be there for him That's what I'm wondering. He's going to have to live with this, and he may develop brain-related chronic fatigue syndrome. That would be G9 3.32. Regular, quote unquote, regular chronic fatigue is R53.82. Muscle atrophy, cervical region, M625A0, thoracic 1, lumbosacral 2. Muscle atrophy, new codes. Sleep apnea of newborn, new codes here. We always talk about prevention. Always try to be proactive. I call it SWAN. That's my favorite acronym. SWAN. We want you to SWAN, which means sleep well at night. Most of the chiropractors that we work with, and medical doctors and physical therapists, we work with a lot of physical therapists treating traumatic brain disorders. Most of them are working with us to prevent problems. 80%, 20% are in a crisis. They're being audited. Just got a new case yesterday. Doctor is being audited. Blue Cross Blue Shield wants $200,000 back. And it's all about E&M codes. Speaking to the doctor, he said, well, I thought I was doing everything right. So he's in a crisis. He's panicking. He's really upset. $200,000 is a lot of money. So that's the 20% crisis. 80% prevention. So before we get to questions and answers, let me tell you a little bit about target coding. We've been helping healthcare providers for over 15 years. Besides these wonderful webinars and seminars, which most are approved for continuing education, we are audit specialists, Medicare, United Healthcare, Cigna, Blue Cross Blue Shield. Yeah, let me tell you, I've also written a book on the best codes to improve reimbursement. We write manuals on HIPAA, billing and coding, Medicare compliance manuals. HIPAA and billing and coding are mandatory. Every office needs to have these manuals. Let me give you the number one reason why you should have a billing and coding policy and procedure manual. It's to prevent whistleblower action. Yes, do you know what that means, doctors? That means if you have a billing and coding if you don't have a billing and coding policy and procedure manual, you could have a disgruntled employee contact an insurance company or a state board and be a whistleblower and say you aren't doing things right and you're going to have big problems. So by having a billing and coding procedure manual, it's the number way to prevent any staff member from becoming your enemy and becoming a whistleblower. And remember, whistleblowers get a piece of the action. There's one doctor from Iowa, a whistleblower action took place. The Department of Justice fined the doctor $80,000. Well, the whistleblower is going to get about 10%, about $8,000. So get a billing and coding policy and procedure manual, doctors, to prevent your staff from becoming your enemy and filing a complaint against you. Now, besides wonderful webinars and seminars and books and training videos, we do billing. Yes, Target Coding now does billing. We also will go after your accounts receivables. Those of you that have money owed to you over 120 days, give that to us. Keep your billing company, keep your staff. We'll go after your money. If we don't recover anything, there's no fee to you. Scan that code right on your screen to set up a free consult with me and Brandy. She runs that division. We also do credentialing. Would you like to go in network with Aetna, Cigna, Blue Cross Blue Shield, ASH, Optum, United Healthcare? Let us know. Would you like a Medicare PTAN number? Would you like a Medicare PTAN number for DME? Yes, we do credentialing. We offer memberships. Many people prior to this webinar, they said, can we get the slides? Can we get the PowerPoint presentation slides? If you're a member, yes, members get all the slides and access to all the playback videos. Spinal decompression therapy, one of the most popular ancillary services provided by chiropractors. Well, some doctors aren't doing it properly, and they're billing patients cash for decompression when it was just regular traction, or vice versa. Some doctors are in network billing patients cash for decompression when it's covered in the plan. So let us know if you're interested in our spinal decompression billing, coding, and compliance program. We'll analyze your decompression financial care plans, fee schedules, and prepaid discounts if you offer that. We'll provide you with a specific spinal decompression coding and compliance manual with customized policies and procedures. We'll provide you with spinal decompression intake forms, HIPAA forms, Medicare forms. You get a cloud-based coding and billing library. That's where you can download employee training logs, authorization forms, chart order tools. If interested, scan that QR code or call or email us for a free consultation. All right, let's go take a look and see what questions have come in. Oh, also, we have tons of testimonials nationwide. Most of our seminars and webinars are approved for CEUs. My recommendation is go to the Target Coding homepage and put in your email. Right on the homepage, there's a box to put in your email, and you get added to our list. And then once a month, we put out a little newsletter, little pearl, little oyster of information regarding billing and coding and documentation. There's a lot of changes coming up for 2023. We're going to have a webinar in a couple of weeks with all the changes to ICD-10 and CPT and HCPCS and all the new deductibles and thresholds. Just a few closing comments here. Please check with all the carriers you bill prior to submitting claims to ensure that it is compliant. We can't guarantee this information. We'll guarantee payment from any insurance company or patient. You know the rules change all the time. It's important to stay on top of these changes by attending seminars and webinars and joining your national and state professional associations. Let's go take a look and see what questions have come in. Yeah, check us out on Instagram and Facebook. Follow us on Instagram and Facebook. Check us out on YouTube. We have over 100 free videos on YouTube. I want to thank everybody for attending. Here's our contact information: email info@targetcoding.com, website targetcoding.com. If you have any questions regarding this topic or any questions regarding chiropractic, physical therapy, medical, acupuncture, billing, coding, documentation, Medicare, HIPAA, give us a call. Scan that QR code, set up a free consultation. Okay, again, I want to thank everybody for attending. I hope you learned a lot.